Impact segment tonight. While the Houston Chronicle and other left-wing newspapers continue to editorialize against tough action on the illegal immigration front, the evidence is mounting that things are completely out of hand. In Harris County, the Houston area, one study says immigration, both legal and illegal, cost the taxpayers there nearly $600 million. Joining us now from Houston, Charles Baccaris, who's running for a judgeship in Harris County and has publicized this study. We're talking mostly medical situation here. Tell us how this study went down and the conclusion you arrived at.
That's right, Bill. What we have here in Harris County, Texas, the third largest county in the nation, our public hospitals are providing care for all of our citizens. And I decided to get out and run for CEO of county government. And the first day I launched my campaign, we talked about the fact that immigrant care in Harris County is a huge burden on our taxpayers. We need to provide this care, but we also need to make sure we can bill and collect for this care that's provided. So we launched off on this issue. And of course, as you mentioned, the newspaper got all over me. My opponent said it's really not the job of the county judge. But we kept working with our Harris County Hospital District, and we pushed and pushed and pushed. And finally, they produced, through Freedom of Information Act, a memo dated November 13th. We first raised this issue in August. They produced this memo November 13th, which says, indeed, over the last 3 years, the citizens of Harris County have footed the bill for $589 million in health care that's been provided to illegal and legal immigrants.
Okay, so in November, a memo, November 13th, 2007, last year?
That's correct.
All right, the memo was written by whom?
The memo came from the CEO of the Harris County Hospital District to the governing body of Harris County.
Okay, so that encompasses all the hospitals in the Houston area, in Harris County.
We've got 3 primary care frontline hospitals, and they manage our level 1 trauma units, and they see thousands of patients a day.
So now, most of this emergency room situations here?
A large part of it is, absolutely, which obviously is the most expensive way to treat patients. But the point that shocked me was, once the data came out, the politicians in this area did absolutely nothing about it and said nothing about it. It was almost like being in the Twilight Zone.
But you know
Here
why.
we've uncovered.
You know, Houston is a very big Hispanic city with a very liberal press. You've been demonized for just putting this out. The politicians don't want to get involved with this. But the number, $600 million over a 3-year period, $200 million a year, the folks in Houston are picking that tab up, right?
You're right. You're right. It's not a bottomless bucket of money here. The taxpayers are covering this cost. And I'm not saying that we shouldn't provide the care.
You have to. By law, everybody should understand, by law in the United States, no matter you're legal, you're illegal, you're an alien from Mars, it doesn't matter. You walk in with a malady, you have to be treated in the emergency room. That's the law. But it looks to be out of control in Houston because that number is staggering.
It is staggering, and clearly we've got a challenge. And you know, thankfully, the federal law also provides that with sponsored immigrants, those that are here doing it legally, there is a legal document called Affidavit of Support, which says if I, as a sponsor, one of my people that I'm sponsoring accesses government services, I'm on the hook to repay government for that service.
You know that never happens.
Well, I know, but we're going to make it happen. It requires leadership, and we're going to get after it.
All right. Well, look, I just thought the number warranted national exposure because $600 million over a 3-year period just shows you how acute in Houston the alien problem is, both legal and illegal. And we appreciate it. Well, Mr. Baccaris, thanks very much.
And I think if it's here, it's happening everywhere in the country.
Oh, absolutely. When we come right back, John Ritter died at age 54.